Hey everyone, welcome to this explainer. Today we're going to break down the micro to macro journey of how the cholesterol medication Leqvio actually works. I know as first-year pharmacy students, you're just getting hit with an absolute tidal wave of drug classes, mechanisms, and guidelines right now. So my goal today is to make this cutting-edge genetic therapy incredibly easy to understand. We're not going to overcomplicate things. Instead, we'll build a really vivid picture in your mind of exactly how this drug operates, how it stands out from the crowd, and why it's such a massive game changer for patient care. All right, let's take a quick look at our syllabus for today. We'll start with the LDL cholesterol challenge, move on to silencing the PCSK9 factory, and then clearing the bloodstream. After that, we'll cover Leqvio versus traditional meds and wrap it all up with the impact on the patient. Section 1. The LDL cholesterol challenge and why standard treatments fall short. To really get why this new drug matters, you have to understand this situation you're going to see every single day in your clinical rotations. Picture this. A patient has cardiovascular disease, they're prescribed a daily statin to lower their bad cholesterol, but their labs come back and they're still missing their target of getting LDL under 70 milligrams per deciliter. So why does this happen? Is the medicine just a dud? Well, sometimes it's statin intolerance, sure. But honestly, often it's just human nature. Think about trying to flawlessly stick to a daily pill regimen for decades. It's incredibly hard. Pill fatigue is a very real thing. Get this, up to 80% of patients with ASCVD struggle to hit their LDL goals. 80%. That is a staggering number. And this high failure rate is so often just due to suboptimal adherence to those daily routines. So the big takeaway here is that we don't just need drugs that lower cholesterol. We desperately need treatments that actually fit into messy, real human lives. And that sets the perfect stage for our clinical solution. Let's move to Section 2, silencing the PCSK9 factory, working inside the liver cell. Leqvio, which you'll also see under its generic name, Inclisiran, belongs to a really fascinating class of drugs. It's a first-in-class small interfering RNA, or siRNA. Now, do not let that molecular biology jargon freak you out. All it means is that Leqvio hacks a totally natural process in our bodies called RNA interference. Its entire job is to intercept genetic instructions inside a cell and stop a very specific protein from ever being produced at its absolute source. Think of this cellular assembly line as a four-step infiltration. First up, Leqvio has this special chemical tag called GalNAc. You can basically think of GalNAc as a biological GPS that directs the drugs specifically and exclusively straight to the liver cells. Once it's inside the liver cell, it loads onto something called the RISC complex. Once loaded, it actively hunts down the specific messenger RNA, the instruction manual that tells the cell to build a protein called PCSK9. It cleaves, or cuts, that mRNA. Without those instructions, boom, the factory halts the PCSK9 production entirely. Actually, if you want a super simple way to remember this for your exams, just think of that RISC complex as a biological paper shredder sitting right there inside the liver factory. Leqvio essentially feeds the specific instruction manual for the PCSK9 protein straight into the shredder. Because that blueprint is continuously being destroyed, the factory literally has no choice but to stop producing the protein. It's elegant, it's targeted, and it treats the issue right at the genetic root. Section 3. Clearing the bloodstream. More receptors, less cholesterol. Okay, so we've successfully shut down the factory. But what actually happens to the liver cell once that PCSK9 production is halted? Well, to answer that, you kind of need to know what PCSK9 usually does. Normally, PCSK9 acts like a saboteur. It binds to LDL receptors on the liver and marks them for destruction. But because Leqvio just shredded the instructions, there is way less PCSK9 protein being synthesized. And with no PCSK9 around to destroy them, those LDL receptors are suddenly free to continuously recycle back to the surface of the cell. More receptors survive, which means more receptors are present on the cell surface. I love to visualize these surviving receptors as millions of tiny cholesterol vacuums on the surface of the liver. It's simple math. When you have more vacuums plugged in and running, you clean the room a whole lot faster. In this case, these receptors are endlessly sucking bad cholesterol directly out of the circulating bloodstream and pulling it into the liver to be processed. More vacuums equals less bad cholesterol in the blood. Pretty straightforward, right? Section 4. Leqvio versus traditional meds, comparing mechanisms and dosing. Let's zoom out a bit. While daily statins work by blocking the liver from making cholesterol in the first place, these newer injectable therapies focus on clearing it from the blood. You're definitely going to see a lot of monoclonal antibodies out there, like Repatha, And Repatha is a great drug, but it works completely differently from Leqvio. Think of traditional monoclonal antibodies as bouncers standing outside a nightclub. They have to physically catch the PCSK9 protein after it's already been made and is floating around outside the cell. Because there are just so many proteins, the bouncers get overwhelmed fast, which is exactly why patients have to self-inject those drugs every 2 to 4 weeks. Leqvio, being an siRNA, sneaks inside the cell and turns on the factory's paper shredder. It stops the protein from ever being made in the first place, giving it a remarkably longer duration of action. And because of that prolonged intracellular RNA silencing, basically because that paper shredder just keeps on working for months at a time, the dosing schedule completely transforms. A patient gets an initial injection on day 1, a follow-up dose at month 3, and then they only need maintenance doses every 6 months, literally just twice a year. Which brings us to our final section, impact on the patient. Proven clinical efficacy. So, zooming all the way out to the macro level, does shutting down the factory actually work in a clinical setting? Absolutely. The pivotal Orion 11 clinical trial gives us the hard proof. When added to a maximally tolerated statin, there is a potent and sustained drop in LDL cholesterol compared to a placebo. We're talking an average reduction of around 50%. And what's really incredible is how powerfully sustained that reduction is. It just stays flat across the entire 18-month trial period. That is the sheer power of RNA interference at work. But honestly, the most important metric might just be how this actually feels for the patient. Donna, who is currently taking Leqvio, sums it up perfectly. I just go twice a year now. I walk out of the office, and I don't need to think about it until the next visit. By replacing daily pills that are so easily forgotten, or biweekly self-injections that can be a real pain, with a simple twice-yearly injection administered by a healthcare provider, we drastically reduce the burden of treatment. We are finally tackling that massive 80% adherence challenge we talked about at the very beginning of this explainer. Pharmacy is changing so fast, you guys. We're rapidly moving from daily symptom management to targeted genetic-level interventions. So as you prepare to enter the clinical world, I want to leave you with this thought. How will mastering these new genetic mechanisms, like siRNA therapeutics that turn daily struggles into twice-yearly visits, completely reshape your future pharmacy practice? Definitely something to chew on while you study. Thanks so much for hanging out with me on this explainer, and I'll catch you in the next one.